Welcome to Ovatis today. My name is Dr. Abna Asiayepoa. Ovatis today is a non-governmental, non-profitable organization, and our main aim is to educate people from all walks of life about sexually transmitted diseases and other pathologies of the female and the male reproductive system. Our topic for the week is
from the Ovatis Medical Group, and I want to share with you Chlamydia. Chlamydia is a sexually transmitted infection caused by the bacterium Chlamydia trichomatis. It affects almost about 4 million people each year. Through vaginal, anal and oral sex, and sometimes by sharing of sex toys. The bacterium lives inside the cells of cervix, urethra, rectum, and sometimes in the throat and eyes. Other mode of transmission would be a mother-to-child transmission, and that is through and during vaginal birth. That is when the woman passes that to the baby, which can cause fatal complications, which I'll be talking about later. A very important and very serious question here, because it is basically asymptomatic, and that is why we call that a silent infection. This causes a whole lot of complications due to the absence of signs and symptoms. Now, other signs and symptoms may come in here, and I want to talk about that of the woman first before I consider that of the males. What happens in the women is they usually have this abnormal or unusual discharge that comes from the rectum and the vagina especially. Sometimes they have this burning sensation during urination, and sometimes also we can talk about some bleeding that comes in during and after sexual intercourse. Talking about differential diagnosis here, this pain is totally different from that of endometriosis and other pathologies that will be associated or that will be localized in the lower abdomen. As a result, the pain here wouldn't be so pathognomic for chlamydia. It may be present or it may be absent. Pain is not so intense and it's not piercing pain. One would just describe it as a blunt pain that comes on and off. Men may notice discharges, unusual discharges that looks more like cloudy white watery discharge from the tip of the penis. Also during urination, there is this feeling of tingling or irritative sensation in the penis. They may also experience some testicular pains that comes on and off as well. Well, if chlamydia is left untreated, it becomes a very serious, a very fatal situation, and it usually happens a lot because you normally find about 70% of women asymptomatic and about 50% of men not experiencing any symptoms as well. So this can go a long way to affect their sexual organs. Now in women, what happens is it actually affects the fallopian tube and destroys it. That is, after contacting PID, pelvic inflammatory diseases, this causes destruction of the fallopian tube and may lead to infertility. And during then, if a woman have chances of getting pregnant, the pregnant might result in an ectopic pregnancy, which might eventually be aborted. So I give a big caution to the woman to try as much as possible to do all these tests before and after pregnancies. Now in males, this chlamydia can stretch or extend to the epididymis and may cause some testicular, some penile and male reproductive pains and might even result in infertility as well, because it might destroy some of the cells and may cause impotency and might finally result in infertility. Diagnosis will actually come from your doctor, not you the patient, because most of the signs and symptoms are not pathognomic. So what your doctor will tell you to do is to go for a serological test for a positive or negative result. Now, if you are positive, that is where we jump to treatment. Now, treatment. The good news is it is curable and treatment is very simple, but I wouldn't recommend you to go to these over-counter pharmacy shops. Go get it, because I have told you it is this and that. We have doses to take and all that, and if you forget to take the right dose, you might complicate yourself. So the best thing is to go and see your doctor for him to prescribe the right treatment for you. Now, the treatment for chlamydia is in two ways, but in all antibiotics. We can talk about one popular azithromycin, which is actually given once a week, or doxycycline, that is twice a day, and they are all very, very effective. Now, in terms of preventive measures, I've got 3 ingredients for chlamydia free. 1. Abstinence. 2. Faithful or monogamous partner. 3. Medically approved condoms called latest condom. It's been Dr. Jackson from Ovatis Medical Group. Tune in next week for more updates.